shortly. I'm afraid my presentations are very long because I try to give the maximum and try to touch the maximum of subjects. Usually it takes 2 hours, the consultations that I make.
I would just add something to what
Yeah.
you mentioned. It's interesting you mentioned the central monitoring. We've adopted that recently, and it's risk-based monitoring. And I find myself it's great because you have access to all of your systems. You before you go out to do your monitoring, you will check all of your systems. Let's say all of your questionnaires, all of your protocols that have been placed in the regulatory documents. So you have a good idea of what your site is doing. And then when you go to the site, you're very focused. So you know what you're looking for, you know what data points to look for, you know what kind of regulatory documents to look for. So this to me is, I think it's brilliant. It's something that we needed a long time ago when we used to travel so much. And it's actually, I can see it in my job. I used to travel a lot more than I'm traveling right now. And I find, like I'm sitting at my desk and I have access to almost everything. I don't have access to the patient's chart, obviously, because it's not yet, I know some hospitals do allow that, but it's not yet approved. So I don't get to see the patient's charts. And that's the only reason that I would go to the hospital, just to check, the results and to make sure that, these patients actually exist. So it's what you said, it's risk-based monitoring. I think it's the best thing that happened to
I just
pharma.
had a few words before we started with Anton, because he recently started in PPD and he told me very interesting thing, to what extent it saves time. You can just say the same things. I was impressed from what you said. How everything is automatic, how
Yeah, when you work from home, a lot of people in large global CROs or global pharma, they work from home. Means that you have to ensure, as like a manager, you need to ensure that people are actually doing job. Because if you can't, even those who do like a trial assistants who just file documents, there's no cabinet in your office, so you can't just take a document, print it out, and put it somewhere like it used to be. So everything needs to be electronic, and that's why especially large corporations, they put a lot of things, a lot of emphasis on having things electronic. So you have access. I work with the CTMS, Clinical Trial Management System, that allows me to track the documents, and I know exactly when the document, at which day, where is it, like how it's moving in the process. You have ETMF, Electronic Trial Master, so where documents are actually filed. And right now, a lot of these ETFs, they allow you to, like the ones we work on, you don't even need to name documents anymore. So you basically drag and drop whatever you like to call the document and just choose from the options, investigator brochure. And then this system would actually scan and see and name document automatically. It saves tremendous amount of time for technical assistants who would when I worked before in smaller companies. Yeah, you would need to, we have to develop a naming convention, then to push this naming convention that all the documents need to be called the same way, and people go and leave, and every time you have to ensure that it's still named the right way, and it takes you a month until people understand this. So a lot of time are lost. When you work with electronic systems, when things are automatic, you actually save a lot of time on this. Use a lot of a lot of support when for subject recruitment. So you use special support for startup procedures. When we have a portal where all the documents are collected during the startup phase, when you're just getting started with the study, it's like a one exchanger. Everything is there, so a lot of people have access. Even clinical sites have access. They don't ask you stupid questions. Have you received this document from me? No, like go on this portal and see yourself.